Root canal configuration and its relationship with endodontic technical errors and periapical status and premolar teeth of a SARI subpopulation, a cross-sectional observational CBCT study done by Dr. Yahya et al. In 2023. The root canal treatment is a complex multi-step procedure designed to salvage a tooth with irreversibly inflamed or necrotic pulp. Successful treatment is indicated by adequate periapical tissue healing, and endodontic technical errors can result in incomplete debridement and poor obturation of the root canal, which will allow the microorganisms to survive and multiply there and eventually will cause infection, resulting in endodontical failure. The endodontic technical errors are the foremost cause of treatment failure. A thorough understanding of root canal configuration is essential to prevent these iatrogonical errors. This study used a pre-existing CBCT images to determine the association between root canal configuration, endodontic technical errors, and periapical status. The CBCT images were collected of 101 patients, which including a total of 212 obturated premolars that were assessed. The root canal configuration were classified according to Verrucci system, and the presence of endodontic errors and periapical lesions associated with each root canal configuration were noted. Also, the presence or the absence of coronal restoration and its association with periapical radiolucency were recorded. The following data were recorded for each root canal treated premolar for two outcomes. The primary was the presence of different root canal configuration in root canal treated premolar according to Verrucci classification of the root canal configuration. And the secondary outcome were the presence and association of endodontic technical errors and periapical lesions of different root canal configuration. They found out that the most frequently noted root canal configuration in this current study were type 1 with 77.73%, followed by type 2 with 10.15%, and then type 4 with 8.59%, followed by type 5 and 3, 7, and 8. The underfilling and the non-homogeneous filling were the technical errors more frequently observed, with a collective of 85.9% for the total errors. The absence of coronal restoration caused apical lesions in 93% of the cases. So the result of this study highlight the role of preoperative assessment of the root canal configuration for the success of endodontic treatment. As a conclusion of the study, the frequency of endodontic technical errors increased as the root canal configuration became more complex. The most common technical errors observed in endodontically treated premolars were underfilling and non-homogeneous filling. There was also an increase in the prevalence of periapical lesions in teeth with endodontic technical errors and/or the absence of coronal restoration.